Have you ever been listening to your child sleep and heard them snoring and thought, is that normal? Or maybe you've heard that awful grinding sound of their teeth at night. Well, in this explainer, we're putting together a kind of pocket guide for parents using some amazing insights from pediatric specialists to help you decode those super common but sometimes really confusing health signs.
Okay, so here's a quick peek at what we're going to cover. We'll kick things off with that nighttime noise, snoring, and then dive into some really surprising mysteries about the mouth and jaw. After that, we'll talk about a crucial safety tip for infants, and we'll wrap it all up with what might be the single most powerful tool you have for figuring out your child's health.
All right, first up, snoring. I know, it might seem kind of cute or just harmless, but what if that nightly noise, or, your child just constantly breathing through their mouth, is actually a signal that something else is going on that really needs a closer look?
So let's start with this really simple observation. This is often the very first clue. And according to the specialists we're looking at, this isn't just some quirky little habit. It can actually be the first piece of a much larger health puzzle that is absolutely worth solving.
So, what else should you be looking for? Well, if you see that chronic mouth breathing plus some other things, like they're sleeping really restlessly, they always have a runny nose, or especially what doctors call failure to thrive, which just means a kid isn't growing or gaining weight like they should be, that's a really strong sign that their airway might be blocked.
So what's actually causing this? Well, a lot of the time, the culprits are in large tonsils or adenoids that are physically getting in the way. And the specialists really emphasize that just waiting it out isn't always the best move. A blocked airway can lead to a whole bunch of other issues, even affecting how their face develops, and meaning they might need orthodontic work down the road.
But here's the good news. Getting a diagnosis is pretty precise. Doctors have tools, like a flexible endoscope, that let them take a direct look at what's happening inside. And sometimes it's a team effort, bringing in specialists, like speech pathologists, to make sure they get the full picture and that nothing gets missed.
Okay, so let's move from the airway right into the mouth itself. This is where we find even more surprising issues that, believe it or not, often get misdiagnosed.
Bruxism, the fancy term for teeth grinding. If you've ever heard that awful, grating sound coming from your child's room in the middle of the night, you probably think, oh, it's just stress or a bad dream. But the real cause can be something you would literally never guess. So just take a second and think about it. What's your first instinct here? Is it anxiety? Maybe a dental problem? Well, there's a fascinating case study that revealed a completely different and pretty surprising answer.
And this is a perfect example of why we can't just jump to conclusions. In one case, a doctor found that a little boy's really severe teeth grinding had nothing to do with stress. After digging a little deeper, they figured out it was linked to a virus. And get this, his twin brother and even their dad were also grinding their teeth, and it was all from the exact same treatable infection. Wild, right?
Okay, another mouth mystery, TMJ disorder. Now, this one is super tricky because the problem is in the jaw joint, right? But the pain can pop up somewhere else entirely. For instance, specialists see patients all the time who come in with a terrible, persistent earache, only to discover the real root cause is actually their jaw.
And the cause isn't always physical. One doctor told this story about a patient with a long-term TMJ problem. After a really long chat, they actually traced it all the way back to the emotional stress and loneliness she felt after moving from a place where she knew everyone to a new, more impersonal neighborhood.
All right, let's switch gears for a second. Moving from diagnosis to prevention. Because for the littlest ones in the family, sometimes the absolute simplest bits of knowledge can make the biggest difference for their health and comfort.
So a lot of new parents wonder, is it okay to feed my baby while I'm lying down? Well, it can be a little risky, especially with formula. And the reason has nothing to do with comfort. It's all about a tiny little tube inside their head that's built totally differently than in adults. And here's the key difference. See, in an adult, the eustachian tube that connects our ear and throat is angled down, so fluid just drains right out. But in a baby, it's wide and almost completely horizontal. What that means is, when a baby is feeding flat on their back, milk can flow right from their throat into the middle ear, and that can lead to some really painful ear infections.
So what's the solution? Thankfully, it is so simple. Whether you're breastfeeding or bottle feeding, just prop your baby up a little bit at about a 30 to 45 degree angle. Just making sure their head is higher than their stomach lets gravity do the work, protecting their little ears and helping with digestion too.
And this brings us to our final and honestly most important section, This is what really ties all of these stories together. It's the difference between just getting a quick fix and finding a true solution.
You know, when we see a problem, our first instinct is to find the fastest possible solution, right? A night guard for teeth grinding, some drops for an earache. But the specialists we've been talking about argue that when we rush to just treat the symptom, we often miss the real problem entirely.
This quote right here really gets to the heart of it all. As one specialist explained, diagnosing something complex like TMJ isn't a 5-minute job. The big takeaway here is that a real diagnosis takes time, it takes patience, and it takes listening to a person's entire story, not just zoning in on one single symptom.
And this, right here, is the key. Whether you're a patient or you're a parent, the most powerful tool you have is just being curious. It's about moving beyond asking, what is the symptom? And starting to ask, okay, but why is this happening? That's the first step to finding a real, lasting solution, not just a temporary Band-Aid.
So we'll leave you with this thought. The next time you notice a symptom in your child that just won't go away, a cough, not sleeping well, an ache, challenge yourself to look past the obvious. Ask yourself, what is the real story this symptom is trying to tell me? Because that's the question that will lead you to real answers.